Dr. Beth Molleson.
And I'm Dr. Alyssa Watson.
Thanks for joining us in the Veterinary Breakroom today. These are short conversations where we chat informally about relevant topics in vet med. And today, Dr. Alyssa and I are going to talk about something that I came across and it made me giggle. So I figured, why not chat about it? And that was just an article about escaping the exam room, which I love. I love that that's even something we have to talk about in this profession, is how to get out of the exam room. And I do also want to talk about it from the angle of getting out of the exam room when we want to take a minute to regroup. I think we've all been in those settings where like we're in there examining a patient and like even halfway through the exam, the owner's like, okay, what's wrong? Like, what are you going to give us to fix this pet? And meanwhile, you need a minute to think, you need a minute to look something up, you need a minute to consult with a colleague, you need to go read the medical chart, like all those or the other big scenario, the one that made me laugh, was the idea of we've also all been in the exam room where we cannot get out and we're stuck with a pet owner that won't stop talking and we just got it, or even worse, doing something that makes us uncomfortable or makes us feel unsafe and we just need to get out of there. So Alyssa, can you relate to this topic as much as I felt like I could when I saw it?
I absolutely could. And it's funny because just like you said, there's kind of these two extremes. There's the, I have got to get out of this room because I've been in here for 45 minutes. And if I don't find some way to get out, I'm going to be trapped in here for another hour listening to, stories that have nothing to do with why the pet has presented today or things like that, or there's the other situation where I'm feeling very pressured, that I feel like the owner really wants, some sort of answer right now. And I want to find a way to just step away for a moment without compromising what the owner thinks of me. I want to make sure that the owner still has trust in what I'm doing. And so I've never felt very comfortable just saying, I don't know what's going on. Although, when we'll talk about this, Dr. Beth, sometimes that might be the best approach, just to say, I don't know what's going on. I need a minute. So, So yeah. Have you had that situation where you've just point blank told a client, I've never seen this before. I don't know what's going on. And if you did do that, how was that received?
Yes. And I think what's interesting, and one of the reasons I wanted to tackle this topic from just as a serious side note, is that it took me, I feel like, several years, maybe I'm still learning this, that it is okay and absolutely not my responsibility to know everything that is going on with a pet, particularly upon initial exam. And what's funny is I feel like I'm so much more prone now that I've been practicing for 12 years to say, hey, I gotta go, to excuse myself or do whatever I need to do to find the answer, to show that vulnerability. Whereas a new grad, on the first day, you're trying to hide that. And I feel like that's my PSA of the day, is that, whenever I'm feeling like I should know what's going on, I think back to my own general practitioner and the idea of walking in his office and me having potentially some complex disease process. The idea of him knowing what's wrong with me based on a physical exam, I mean, that's so far from what happens in human medicine. And it always helps me to take a step back and remind myself of that. The fact that, usually I need to be sent to a specialist. I need to be sent off to the lab. There needs to be extensive testing done. There needs to be other doctors involved. So remembering that helps me realize that it is okay to not know what's going on right away. And so, yes, to answer your question, I feel like I've gotten much more comfortable with that. My favorite, and I feel like I have directly said, like, hey, I'm not sure what's going on. I feel like when I'm feeling confident, that's when when I feel confident in the fact that it's okay that I don't know the answer, I feel like that confidence comes across in whatever I tell to the pet owner. So, saying something like, I need a few minutes to go look at the pet's full history and see if I'm missing something, or I need a moment to go talk with another doctor, or sometimes, and this is usually the truth, but I also feel like saying like, hey, I'd like to take your patient back to the treatment area where I have a special light, or I could have an assistant help hold the pet. And I feel like how it's received depends on how confident I am having that conversation. And so I feel like if I maintain that level of confidence, then generally the trust isn't lost there with the pet owner. But
Mhm.
what's been your experience, Alyssa? Do you feel like you're one that you're prone to say those things to pet owners, or do you kind of try to do more of the covert escape?
So I have, just like you know, I've been practicing 20 years now. And funny enough, that having practiced that long also gives me, I think, more credibility because I've said it,
Mm-hmm.
I'll say something like, you know what? No one has ever asked me that in 20 years. So
Yeah.
I'm going to go find out. And I think just the fact that I've been doing it for so long, it's a lot easier to say, hey, you know, I've never seen this in 20 years than I've never seen this in, you know, the whole, if you're a new graduate or something like that, I've never seen this in the whole year I've been practicing. That doesn't oftentimes have the weight, you know, and
Mm-hmm.
so just to let those with less experience or the newer graduates know, hey, there's lots of things that we haven't seen, you know, that I haven't seen after 20 years. And it's okay to say, I haven't seen this before, or I want to go
Mm-hmm.
look that up so that I'm giving you the most accurate information. And I truly feel like if you are being, you know, honest and upfront, that is much better received. I remember when I first started practicing, I had a client who brought a cat in, and they were a very, the client was very confident, and the client was, it was intimidating to me as a new
Mm-hmm.
graduate.
Mm-hmm.
And the client kept using acronyms, and her cat had polycystic kidney disease, but she kept
Mm-hmm.
saying PKD, 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 and and I was a newer graduate, and
That is intimidating.
it was so intimidating. It was so intimidating. And I just kept nodding, and I had no clue what she was talking about. And
Mm-hmm.
I went back
Mm-hmm.
and I got out of the room, and I went and I Googled PKD. And the first thing that came up was like phosphofructose kinase deficiency or something. And I'm
Uh-huh.
like, is this what she's talking about? And so it was a lesson for me, because to be like, just, can you stop? I haven't heard that acronym before. Or can you
Right.
tell me, you know, let me look at your cat's history, because this is the first time that I've seen your kitty before. And I want to make sure that I have all the information. And I totally get that it can take a long time to build that confidence.
Mm-hmm.
But I just want everybody to know that it's okay to start right out of the bat and say, like, let's all get on the same page. There's lots of
Yes.
different acronyms, and PKD could mean lots of different things.
Yes, that's a good I like that story. And it is but you're right though, like that is the confidence that comes with 20 years of practice. I think as a new grad, you're like, "Oh my god, was this something I learned on day 1 of vet school and I've forgotten the acronym? Like I cannot I cannot if this is something simple that I'm forgetting." So it is.
Mm-hmm.
It is hard and that's where it sometimes feels nice to not be a new grad anymore because you do have more confidence. But yeah, that's funny. But going back to your what you were saying that where you're kind of building that confidence with the owner is I also think too, I actually am often, I guess not anymore surprised, but I do find that it's interesting that when I say to pet owners, like, oh, I'm going to go call a colleague, I'm going to go call a specialist, or like, oh, I'm not sure what's going on with this eye. Do you mind if I borrow him to go have Dr. Smith look at it? Like, they like that. They like the idea of having double eyes on the pet. I feel like I very rarely would run into someone that like rolls their eyes. I don't know what's going on. I feel like that communicates that you're taking it seriously. It communicates that you're going to do what it takes to find the answer and that you care enough to like phone a friend. I feel like that usually goes over pretty well in my experience.
I was gonna say it's a little bit similar as I've practiced when I first started practicing. You know, something like telemedicine radiology review was never, you know, we never did
Mm.
that. I didn't have the option at all.
Hmm.
I read all of my own radiographs, and I'm very comfortable reading my own radiographs. I like to read my own radiographs. I prefer to do it, you know, and then kind of compare what I'm getting back. But I would say at
Sure.
probably over half of them now I send out and have, you know, a specialist look at. And the
Sure.
way I phrase that too is the same. I have, you know, the phrasing. I say, you know, I'm going to look at this, and but we're also gonna send it out so I can get another pair of eyes on it, somebody that this is all they do, that's their job, is to look at x-rays, all day long, and that, that'll give us a little bit more confidence in what we decide to do moving forward. So
Yeah, no, absolutely. I think the other thing too, well, I like that phrasing for the radiologist because I do feel like sometimes that's a I don't want to say awkward, but like if you use the wrong language, I feel like it can be awkward to kind of um, admit your vulnerability there. But I do think it's good to do that because I think it's good to remind people that I don't know everything. I don't get to spend as much time looking at x-rays as the radiologist does. And so, yeah, I've kind of switched to verbiage like you have where like we want trained eyes on these x-rays to make sure we're not missing anything. But the other thing I was going to mention too that was brought up when I was looking at tips for having these discussions with pet owners was body language, and I just wanted to point that out because I do think it's one that goes over something that goes overlooked, especially as new grads when like the adrenaline and anxiety kicks in the moment you walk into the exam room. So being mindful of body language, I thought that was interesting advice because really that can sometimes speak louder than words. So just trying to maintain that inner composure and make sure it shows with how you're presenting yourself to the client. I thought that was interesting. And then go ahead.
So I was going to say, so you don't look like I do sometimes, like a deer in the headlights.
Yes, exactly. Like fiddling with the ring on your finger. Yeah, visibly sweating. We've all been there. And then one other piece of advice that was offered was to like find resources to share, which I thought was a good tip too. Like, if you do need to kind of escape that exam room, was to go find, maybe some resources that you say you're going to go find resources to share with the pet owner, and that'll give you a minute to regroup and make sure you're not missing anything. But I wanted to talk about too, Alyssa, because I feel like this is again kind of what I feel like happens more often is back to that scenario where we're getting stuck in the exam room with just chit chatting. And I want to hear what's your most creative excuse that you have used to get out of the exam room, or do you just have a go-to that you use to escape when needed?
So generally, oftentimes these are clients that I've known for a long time, and so I'll set something up possibly with my technician as kind of like a fail safe. Like if I'm in there for more than 15 minutes, can you come in and say, Dr. Smith is on the phone and is waiting for me. So that's one I've used. Although I would have to say, in my career, the I try really hard not to, even though we talk about white lies and what's the definition of a white lie and does it really not hurt anybody, I have horrible luck. And I find if I lie about something, then something horrible is going to happen. I mean, so for instance, the other day, somebody asked me if I was going straight to the, because I do in-home hospice and euthanasia, as part of my job now, and somebody had asked me if I was going straight to the aftercare facility, and I don't normally. I have a place at my home to store the pets, and the aftercare facility comes and picks up, and but I felt that was information that they didn't really need, and so I was like, oh yes, that's we're going to do that right now. And she's like, great, I'll follow you, and I'm like, okay, well now we are going.
Oh no. Did you at least have a place to go? Like, could you drop the pet?
Oh yeah.
Okay,
no,
good.
Yeah, that's what we did. But you just need to be careful that if you have a white lie planned, that you have to be able to back that up.
Oh my gosh. Yeah, I feel like you're right. I feel like white lies are not often needed in practice because in a busy practice, like if you disappear for more than 5 minutes, someone truly does need you and someone's going to come find you and get you, especially if they know that the pet owner is rather loquacious. So yeah, I think we can thank support staff a lot for coming in to rescue us in those scenarios, but that's funny. Yeah. You never know when a lie is going to catch up with you.
Yeah. Oh, like I said, I have bad luck with stuff like that. So
Oh, goodness, that makes me laugh. Well, Alyssa, I think that about covers it. So I want to get to our win of the week. Do you have any big or little wins for that matter, wins this week?
yeah, I do have I have a nice win. So, and it was from when I was in clinic. Actually, it was a sad case. So I had a patient that unfortunately developed a like fulminating fatal case of ITP.
Hmm.
And yeah, it was tough. But the thing that really got me about this case, and it's kind of appropriate with today's topic, is I had the patient had received a medication shortly before this, and I'm not going to name the product or the company or anything like that because it's not important. But I had mentioned that ITP can sometimes be triggered by things. It can happen without anybody's knowledge. I was, and I had contacted the company and done an adverse event report.
Hmm.
And then couple weeks after, I got a message from my practice manager that just said that the client had called back and they were just very appreciative that we had gone the extra step to report it, and just to like let everybody know these types of things, they can happen. And really, everybody out there, I truly believe everybody in this profession, the veterinarians, the staff, the your reps, the pharmaceutical companies, they really truly are there to support patients and to support your clients. And everybody was so wonderful through this whole process. And even though it was a really sad outcome and the pet passed away, the client felt really supported and really happy, and that made me feel good. So that was my win. It was, yeah, it was a long road, but it ended up, really being something that I feel like everybody pulled together on. And so that was
Yeah,
nice.
I see. I feel like that's a
Oh,
huge win because for anytime there's a case that has that devastating of an outcome, but your care was so outstanding that the pet owner could recognize it in the midst of that tragedy, I think that says a lot about what all the vets and the pharmaceutical company did for them. So
yeah.
that's a little sad, Alyssa, but
How
we
about
will take it as a win
I'm
anyway.
sorry.
Mine is, fortunately, mine is much less depressing, and it goes along with the escape theme of the day, and that was that I
Mhm.
escaped my family last week and went up to Columbus with a friend and went to the Billy Joel Stevie Nicks concert, which I have seen Billy Joel perform before, but had never seen Stevie Nicks, so it was a bit of a I feel like my music taste tend toward the older music, and so a lot of my um what's the word I'm looking for, just yeah, a lot of my favorite musicians are older. And so getting to see these people before they retire or worse is a huge win for me, and so it was a lot of fun. It was up at the Ohio State Stadium, so it was a huge affair. The weather didn't rain or anything like that, and yeah, it was just a great night. And like I said, needed the day off from momming, so it was a big win
That
for
sounds
me personally.
awesome. I would have loved that as well. Yeah, I tell people I'm not sure exactly when in my life classic rock went from like Simon and Garfunkel and became Aerosmith. I'm like, really?
Right.
So, but I guess I'm just getting that old.
I think, yeah, I think, I don't know. I've always liked the oldies, but you're right. It gets more depressing when you hear like music you think of as current on the oldie station. But anyway,
Yeah.
so all right, Alyssa. Well, lovely to have this conversation with you today, and to our audience, thank you for joining us, and we will see you next time.
Thanks, everyone.
Thank you for listening to today's episode of Veterinary Breakroom. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts, or drop us a line at podcasts@vetmedics.com. Veterinary Breakroom is a Vet Medics production produced by Alexis, Ussery, and co-hosted by Dr. Alyssa Watson and Dr. Beth Molleson.